Beginning in 1 week, the ban on large gatherings and shelter-in-place requirements are eliminated. It reduces any remaining distance requirements, including at restaurants, bars, and movie theaters. With that rollback comes concern from public health officials that another deadly surge could be imminent. 11 Alive's Brittany Klein-Peter looks at a big state that eased restrictions and how that affected its COVID-19 cases.
Consistently 3 times a week for 10 weeks, Dr. Walensky has said, wear a mask, avoid crowds, socially distance, and don't travel unless it's absolutely essential. 3 times a week for 10 weeks. We repeat that in all our conversations with governors. We repeat that in all our conversations with local officials so that people who are in violation of that are choosing to do that.
Federal health officials are begging political leaders to wait on easing COVID-19 restrictions. This plea comes from top officials as Georgia prepares to join the growing list of states lifting pandemic restrictions. Last month, governors in Texas, Mississippi, and Arizona were just some of the leaders who announced significant loosening of statewide pandemic restrictions, including removing mask mandates and indoor capacity limits. So what has happened in the weeks since? Let's look at Texas. The Lone Star State lifted their mask mandate on March 10th. Since then, cases dropped, but then started increasing again over the past 10 days. Compare that to Georgia. We've never had a mask mandate, but Governor Kemp announced plans to lift indoor capacity limits on April 8th. Georgia has not seen some of the increases they're experiencing in other states, but experts caution there's another concern. Most Georgia schools have yet to go on spring break, meaning a Georgia rise in cases is more likely to happen in mid-April, about a week after a travel surge, and once places like restaurants, bars, and other venues start to open up more. Exactly 1 week from today, Governor Kemp said that there will be no more enforcement of remaining pandemic restrictions. Coming up at 6, I'm going to take a closer look at variant spread when it comes to lifting those restrictions.